Hello. We wanted to take a few minutes to demonstrate something that may assist you with eliminating some frustration people have had between trying to work on an evaluation or a note as well as seeing some of the clinical documentation in PCC. So many of you have asked, can we split a screen? How can we do this? Some of you have been printing out a blank document, collecting all of your data, and then going back and data entering it afterwards. And that's not what an electronic medical record should result in. You should not have duplicate efforts. It should streamline your work and make you more efficient. So we wanted to be able to provide you a workaround for how that might work. What I do want to make sure that you understand is that this is not just for nurses. Any discipline can benefit from watching this tutorial. So in an electronic medical record, this would be ideal. You'd see two sides of the screen, and on one side would be the summary, the eval, the MDS, your daily or progress notes that you needed to complete, and on the other side you would see all the elements of the chart. However, if you were to look at your screen size on your Chromebook, your laptop, your desktop, what's on the med cart, wherever it is that you happen to be completing your documentation, it's not set up to be able to accommodate the way the format and the spatial setup of the evaluations and notes are in PCC or probably many other electronic medical records. So we again are going to provide you with a workaround that should help eliminate some of your frustrations in trying to get this work done. So when you're in PCC, you want to make sure that you are under the clinical tab. So you log in, you get into it. You may have it set up so that it goes to home, or it may go to administrative tab automatically, but you want to be under clinical. When you're in clinical, you should see a tab up here that says clinical. You want to right click in this area. You're going to open up a dialog box by doing that, and you will select duplicate tab. By clicking duplicate tab, you are now going to open up a second PCC platform. So now you see there are two clinical PCC tabs. This will allow you to toggle back and forth between the two PCC screens as you work on your note. So looking at this at the top, you've got, again, your two clinical tabs. Working under the first one, you can select your evaluation tab, go and find an evaluation that you need to work on. And for my example, I'm going to use the daily skilled note. So once you select the evaluation that you want to work on, your tab will change names to reflect that eval. So now I'm working on the daily skilled note. I'm going through the note and I'm seeing some things are already pre-populated. There's other things that I need to perhaps fill in. And, oh, I have to look at the doctor's orders. I don't know if that's accurate. I need to look at the most recent vital signs or look at a series of them or look at them over the months. I need to look at the progress notes to see if there was a fall. I need to look to see if there was pain. All of these different things that you might need to look at. All you need to do now is click on the clinical tab. And when you do that, it's going to open up the clinical portion of the chart that you can review as you progress through your summary, the eval, your note, or your MDS. So now you see all of the clinical components are there and available for you, but you still have your notes sitting there in the background. So just as you had a paper chart, you had this big thick chart with a bunch of tabs that separated all of the clinical data, and it may or may not have been filed yet. Might be over somewhere else in a bin. It might be filed under the wrong tab. So you're fingering through a bunch of things in the chart, and you've got your paper documentation, and you're trying to write, and you're thumbing through the chart. Page by page, you're going through this big paper chart. Okay? That's what you've been accustomed to. Thumbing through pages of paper documentation and writing down what you needed to know on your evaluation, and then putting that in the chart as well. Now you're going to toggle between data that's stored in the electronic documentation. And the difference is it's legible, it's lightweight, and no paper cuts. So let's look at a live demonstration of how this toggle activity works. So I've already logged into PCC under the training site, and I've chosen this patient, Alan Alda, who's fictional. You'll see that I'm in the clinical tab, and because of that, I have clinical up here. I want to right click, duplicate tab, and now I have two clinical formats. Okay, under this first one, I'm going to go to the evaluations, and I'm going to find an evaluation that I need to complete. So for this example, we're going to click into this little plus sign to see what's due, and let's pick the nutritional eval. Once I've chosen the eval I want to work, you now see that my tab has changed names. It now says nutritional evaluation because that's what I'm working on, and I still have this clinical chart platform here. So I'm progressing through my note, and oh geez, I can't remember if this person has allergies or not. What am I going to do? Let me go to the chart, click on allergy. No, just Keflex. Go back to my note. No, there's no food allergies. Go through the rest of the note. Oh geez, I need to take a look at the doctor's orders to know the answer to that. Go back to the chart, click doctor's orders, and you'll see all of the patient's doctor's orders. Now, mind you, this is the training site, so there's not a lot here. It's not been maintained. All right, I've done that. I also want to take a look at the vital signs. So I can do that, and I can look at all the weights that the person had over a particular time frame. Go back to my note and answer the questions that I was stumped on. You will continue to toggle back and forth between those two platforms to complete this note or any other note that you need to do. So hopefully this will help you with some of the frustrations you've been having on how it is that you can get access to the clinical record as you're working on your note. And again, remember that this is not something that we just want to share with nurses because it will benefit anyone who's working in PCC that needs to be able to go back and forth between that information. If you have any questions on how to do this or it doesn't seem to be working for you, please reach out to one of your regional team members so that they can assist you with this. Thank you.